In this podcast episode, Dr. Sarah Berry, a renowned nutrition scientist, shares her insights on the impact of breakfast choices and lifestyle habits on visceral fat accumulation, particularly in women undergoing menopause. The conversation delves into various aspects of nutrition, hormonal changes, and the importance of understanding how our bodies respond to different foods. Dr. Berry begins by discussing the significant role breakfast plays in our daily energy levels and overall health. She shares her personal experience of transitioning from a breakfast high in refined carbohydrates, such as white bread and pastries, to a more balanced meal that includes protein, healthy fats, and fiber. This change not only stabilized her blood sugar levels, but also improved her mood and energy throughout the day. The key takeaway is that breakfast should not just be a carbohydrate hit. Instead, it should be a well-rounded meal that supports sustained energy and prevents the dreaded mid-morning slump. The conversation highlights the physiological responses to different types of breakfasts. Consuming refined carbohydrates can lead to rapid spikes in blood sugar, followed by sharp drops, which can leave individuals feeling irritable, shaky, and ravenous. In contrast, a breakfast rich in protein, healthy fats, and fiber promotes a more gradual increase in blood sugar, leading to a more stable energy level throughout the morning. Dr. Berry emphasizes that understanding these responses can empower individuals to make better food choices that align with their health goals. As the discussion shifts to menopause, Dr. Berry reveals that a staggering 80% of perimenopausal women report experiencing weight gain or slowed metabolism. This symptom is often attributed to hormonal fluctuations, particularly the decline in estrogen levels. Estrogen plays a crucial role in regulating fat distribution in the body, and its decline during menopause can lead to an increase in visceral fat, which is associated with various health risks, including cardiovascular disease and insulin resistance. Dr. Berry explains that the transition into menopause is not a linear process. Rather, it involves a roller coaster of hormonal changes that can affect mood, energy levels, and overall well-being. The conversation underscores the importance of recognizing these changes and understanding how they can impact dietary choices and lifestyle habits. By addressing these factors, women can better navigate the challenges of menopause and work towards maintaining a healthy weight and metabolic function. Delving deeper into the hormonal changes associated with menopause, Dr. Berry discusses the role of estrogen in fat distribution. Premenopausal women typically have a pear-shaped body with fat concentrated around the hips and thighs. However, as estrogen levels decline, fat tends to redistribute to the abdominal area, leading to an increase in visceral fat. This shift is concerning because visceral fat is metabolically active and linked to inflammation and insulin resistance. The conversation highlights the multifaceted nature of weight gain during menopause. It is not solely about dietary choices. Rather, it is a complex interplay of hormonal changes, lifestyle factors, and individual responses to stress and sleep disturbances. Dr. Berry emphasizes the need for a holistic approach to managing weight and health during this transitional phase, which includes understanding the underlying hormonal dynamics at play. Dr. Berry points out that many women experience a vicious cycle during menopause, where symptoms such as mood swings, sleep disturbances, and increased hunger can lead to unhealthy eating habits and weight gain. For instance, poor sleep can heighten cravings for high-calorie, sugary foods, making it challenging to maintain a balanced diet. This cycle can exacerbate feelings of frustration and helplessness, further impacting mental health and overall well-being. The discussion emphasizes the importance of addressing these symptoms proactively. By recognizing the connection between hormonal changes, lifestyle habits, and dietary choices, women can take steps to break the cycle. Dr. Berry encourages listeners to focus on nourishing their bodies with whole foods, managing stress, and prioritizing sleep to mitigate the impact of menopause on their health. A significant portion of the conversation revolves around insulin sensitivity and its implications for women during menopause. Dr. Berry explains that insulin sensitivity tends to decline as women transition through menopause, leading to higher blood sugar levels and an increased risk of metabolic disorders. This decline is particularly concerning given the rising prevalence of type 2 diabetes among postmenopausal women. Dr. Berry highlights the role of muscle mass in maintaining insulin sensitivity. As women age, they may experience a loss of lean muscle mass, which can further exacerbate insulin resistance. The conversation underscores the importance of incorporating strength training and physical activity into daily routines to preserve muscle mass and support metabolic health. By prioritizing these practices, women can improve their insulin sensitivity and reduce the risk of chronic diseases. The podcast also explores the relationship between dietary patterns and menopause symptoms. Dr. Berry shares findings from her research, which indicate that women who adhere to a healthier diet experience a significant reduction in symptoms. This includes a focus on whole foods, high fiber intake, and the inclusion of healthy fats. The conversation emphasizes that dietary choices can have a profound impact on how women experience menopause, and making small changes can lead to significant improvements in overall health. Dr. Berry encourages listeners to adopt a personalized approach to nutrition, recognizing that individual responses to foods can vary widely. By paying attention to how different foods affect their bodies, women can make informed choices that align with their health goals. The discussion highlights the importance of being mindful of food choices and understanding the broader context of nutrition in relation to hormonal health. An intriguing aspect of the conversation is the role of the gut microbiome in women's health, particularly during menopause. Dr. Berry explains that the composition of the gut microbiome can change during this transitional phase, potentially influencing symptoms and overall health. Research suggests that a diverse and balanced microbiome is associated with better metabolic health and reduced inflammation. Dr. Berry emphasizes the need for further research to understand the specific mechanisms by which the gut microbiome interacts with hormonal changes during menopause. She highlights the potential for dietary interventions to positively influence the microbiome, thereby improving health outcomes for women. The conversation encourages listeners to consider the importance of gut health as part of a holistic approach to managing menopause symptoms. Dr. Berry introduces the Menopause Scale, a tool designed to help women track their symptoms and understand the impact of menopause on their quality of life. This scale allows individuals to assess their symptoms on a scale of 0 to 100, providing a clear picture of how menopause is affecting them. By tracking symptoms over time, women can identify patterns and make informed decisions about their health. The Menopause Scale also serves as a valuable resource for healthcare practitioners, enabling them to better understand the experiences of their patients. Dr. Berry encourages women to utilize this tool as a means of empowerment, allowing them to take an active role in managing their health during menopause. The scale not only facilitates self-awareness, but also contributes to ongoing research efforts aimed at improving the understanding of menopause and its effects. The conversation highlights the critical role of healthcare practitioners in supporting women through menopause. Dr. Berry emphasizes the need for better education and training for healthcare providers regarding menopause and its associated symptoms. Many practitioners receive limited training in this area, which can lead to inadequate support for women seeking help. Dr. Berry advocates for open and informed discussions between women and their healthcare providers about menopause management options, including hormone replacement therapy, HRT. She stresses the importance of personalized care, recognizing that each woman's experience is unique. By fostering a collaborative approach, healthcare practitioners can better address the needs of their patients and provide effective support during this transitional phase. A significant concern raised by Dr. Berry is the phenomenon of meno-washing, where products are marketed specifically to menopausal women with exaggerated claims of benefits. This trend can lead to confusion and misinformation, as many products lack sufficient evidence to support their efficacy. Dr. Berry warns listeners to be cautious when considering supplements and products that claim to alleviate menopause symptoms. The conversation encourages women to prioritize evidence-based approaches to managing their health. Dr. Berry emphasizes the importance of critical thinking and research when evaluating products marketed for menopause. By being informed consumers, women can avoid falling victim to marketing tactics that exploit their desire for relief from symptoms.